I'm Dr. Shankar. I'm a physician by training, and I was in clinical practice for 3 decades before I got into basic nutrition work. And what pulled me into the nutrition work was as a part of clinician, a medical doctor in the army. I was posted in Sikkim, and that is the time that I realized the devastation that iodine deficiency causes. Then I spent 5 years of my active life there working on iodine deficiency, and then one led to the other, and then I got into clinical epidemiology and then into nutrition. Tata Trust is an amalgamation of a number of trusts, and it's one of the oldest philanthropies in the country. The legacy spreads over 130 years. The big areas of focus are education, health and nutrition, livelihood, rural upliftment as a whole, agriculture, water and sanitation. And then these are done through different platforms. A platform for innovation, a platform where is mainly grant making, and a platform to support institution creations. As you might be aware that many of the institutions in the country at some stage have been created with big endowments from the Tata Trust. So we work across the country, and for nutrition particularly, we have Memorandum of Understanding with 5 state governments: Andhra Pradesh, Rajasthan, Tripura, Maharashtra, Uttar Pradesh and Madhya Pradesh. Some of the key areas in nutrition are firstly to work with and within the government system, because that gives you the scale. And as a country, we have several right policies and fantastic programs, but many of them are not working very well, or they're not working optimally. So the idea was to work with that system, catalyze action so that you can reach the scale very quickly. That is mainly working with the Integrated Child Development Services and the National Health Mission. The second focus was in the area of food fortification. Food fortification as a strategy has helped many developed countries and many Western countries to virtually eliminate several nutritional disorders, whereas it is something as a strategy grossly underutilized in developing countries, and particularly in India. So with this in mind, we thought that we should fill the gap and prioritize on staple food fortification, the food that's commonly eaten, whether it is salt, milk, edible oil, rice, wheat flour. These are consumed by most people most of the day, and nearly about the same quantity for different groups. So to add the missing vitamins and minerals, they can serve as an excellent vehicle of carrier. So food fortification is one high priority. And the third area of priority is severe acute malnutrition. Because children with severe acute malnutrition have many-fold higher chance of dying when they get an infection. And therefore, that was one area which we said that we would focus on. Another area is on monitoring, and particularly around data. So for data, it is twofold. One is bring all the available nutrition and related data and make a data portal that is accessible to those program managers, for researchers and general public. And the other one is to get process data of how well the programs are being implemented. So we're trying to get the real-time monitoring of many of these programs done, so that would help supervisory monitoring and therefore improve the service delivery. We are also investing and interested in using innovations in product development as well as the program delivery. Yeah, that's a very interesting thing because we've realized that it's just not only the direct nutrition interventions. As you mentioned, we also have a number of other related investments. So we try to use them all in the same geography so that we try to layer one over the other. For example, in Andhra Pradesh, our major intervention in ICDS is going to be through what we have learned with our education program on early child education and early child development. That's the main entry point. We also are using the livelihood program that we are doing in Andhra Pradesh to be in the same geography, and water and sanitation is another area which would be done in the same 3 districts. So we're making attempts to see that all our investments are layered one over the other in the same geography so that they will have a synergistic action and faster reduction of malnutrition. So we work with many development partners, with other big foundations. Like we have joint platforms created with the Bill and Melinda Gates Foundation in India. We work with the Child Investment Fund Foundation from UK. The 3 of us jointly have created a multi-donor trust fund with the World Bank for one of the biggest programs in India now called the ISNIP, ICDS, System Strengthening and Nutrition Improvement Program, which is being implemented in 8 states at about 162 districts. As I mentioned earlier, we work with several state governments, and we also work with a number of community-based organizations, with local non-governmental organizations, and with the academia. So I don't find it a problem, or in any way it's not just with only big players. They all have their own merits, and we do need partners of different size and with different skill sets. And in the last few years, ever since the CSR law was enacted in India, it is slowly increasing. Initially, it was taking time for companies to understand how to implement it, but I think there are several organizations that have been created, several platforms have come up to assist companies, and in the last 2 years, year after year, the kind of work and the quality of work that they do, the areas where the CSR spending is going, is all improving for the better. Nutrition is not a major focus there. For them, even today, it is curative medicine, health, and now, because of this highly visible Swachh Bharat campaign, water and sanitation are important areas. So we are trying our best to project nutrition as a fundamental, foundational block for human development, and I'm confident that people are seeing value in it and it is moving. With respect to the monitoring of how the CSR money is going, now there are few platforms that put together, compile, and it is easily visible. And with this visibility that is being created, I'm sure that will improve over the years. With nutrition, it's difficult because we start the narrative saying it's complex. And see, there has been so much of problem statement around nutrition, people don't have time. Unless you give with a problem a kind of an action statement or what action can be taken, people lose. So we've got the nutrition community as a whole. We are trying to do it with our partners. Package it and give it to people. Tell a company, if they want to reach, say, 1 million adolescent girls, what is it that is required. If you have $1 million, what can you get for that in terms of nutrition benefits to mothers and children? So we've got to package it and start talking the language that they understand. The same way that we have been stating the problem to governments to do may not work with the industry. See, in the last 1 year, food fortification as a strategy to prevent and control vitamin mineral deficiencies has really picked up a lot of momentum. I think this happened after a global conference on food fortification that was held in Tanzania in 2014. A big delegation from Government of India went. I was also there in that conference, and when they came back, the officials who went, they convened a group, and I made a presentation to them as to where we stand with the food fortification in India. Then the Ministry of Women and Child Development constituted a small expert committee to look at it, and the expert committee recommended that it should be a priority and action should be taken and necessary amendments to existing food law need to be done. Then the next step was the Women and Child Development Ministry constituted a ministerial group, so a group of secretaries and then a ministerial group, and based on their recommendation, the Ministry of Health and the Food Safety Standard Authority has come up with a draft regulation for staple food fortification. As Tata Trust, we have also provided a number of technical support to them as and when it was required. Now for the Tata Group as a whole, as you know, one of the most successful food fortification initiatives in India is the salt iodization. As per available recent data set that was collected in 2015, 92% of the households across the country get salt with some iodine. And in 80% of them, they have adequate iodine. That is, iodine level is as per the standard. Tata Salt from Tata Chemicals is one of the first to be iodized and distributed when the salt iodization, which was a controlled license industry, was delicensed. Tata Chemicals was the one which put out iodized salt of a large quantity. They've been leading, and then when the National Institute of Nutrition came up with a suitable technology to add both iodine and iron in the salt, they took on the lead by started making it. Subsequently, as anemia is such a major problem and iron deficiency is a problem, the Government of India has been focusing and asking many food aid programs to use double fortified salt. So Tata Trust has focused on it and we are providing support. We also brought another way of making double fortified salt other than what NIN has propounded. That is, the University of Toronto has come up with a new method or a new technology of making double fortified salt. We have brought the technology and we are trying to provide it free to many producers, anyone who is ready to use that. So we are wedded to this idea of double fortified salt, but it can be made by different technologies. Our idea is to support producers, scale up, as well as work with the premix manufacturers to see that the price is brought down. I think malnutrition is actually such an important societal problem. So we must involve all key sectors of society to be part of finding a solution to it. In that way, I think businesses are an important pillar of any society and we must involve them to do. You mentioned correctly that companies that are in food business, food and beverage business, have a direct role to play. But it is important to use the private sector as a whole, because they must take this as a part of the challenge and bring whatever they can. Any private sector, to my mind, can play a role, in the sense that if you have, say, a media house, it can play a positive role in spreading the right message. An advertising company can come up with, pro bono help, how to communicate correctly. Logistic companies can help with logistics. There are so many ways. Even if there is nothing, IT companies can play a lot. Information technology companies as a whole can play. But more than that, if they take this as an important societal problem, and then they can use that for their corporate social responsibility. They can widen. There are multiple ways by which we can, but more than that, they should, as a stakeholder group, the private sector should come to the table in the problem solving. It's difficult to be prescriptive, except for food companies. Others, I think, can play a big role if they are brought to the table to be part of the design and problem solving. See, one of the things that we have in the agenda is to bring about a business alliance. That is, get the private sector on board. As I said, the private sector as a whole for problem solving. The second thing is to look at food and beverage companies, because they have currently a big role, and the role will increase. With this rapid urbanization and more people getting into cash economy and more population dependent on markets for their food needs, what we have learned from the Western world, or rapidly urbanizing developing countries, is that as urbanization occurs, more and more people move towards low cost but not necessarily healthy food that is readily available. So as this processed food is going to replace what people have been traditionally eating, it is important that we work with the companies to see that the best that they can do, keeping the nutrition of the population in mind. It's going to be a big task, but we have a lot that we have learned from what has happened in the Western world and what is happening in a number of developing countries. It'll be a bit of coercion, it'll be a question of co-creation, and it'll also have to be regulated and controlled, the role of government. So it's good that all these key players, the government, the civil society, the private sector, food industry, sit together and agree on how to move forward on this. As you know, in India, it is no more in the future. We have this double burden of undernutrition and overnutrition seen simultaneously in the same geography, even in the same households. So we have the problem already, and we need the private sector as a part of the table. So the business alliance will have a big chapter with the food and beverage companies, along with the food regulators from the government and the civil society groups, to really take stock of this and find solutions. I would strongly recommend that they identify, any corporate house, my recommendation is to identify a good civil society partner, an NGO, to work with the communities to increase the community participation in this wide range of public funded programs. One thing that we find is that there are lots of policies and programs in our country. They're not implemented very well. And the one way to improve that is to increase the community ownership of these programs, and by increasing community demand, I'm confident that that will result in an improved program delivery by the public system, because in the sense that the public systems are structured in a way that they can reach the most vulnerable, and the reach that they can have is really unmatched. And the CSR route, rather than creating parallel systems, if they would use their resources to improve community participation in public funded programs, I think that would be a big, easy, quick win.